what we're working with is the survival brain. And the survival brain works by getting safety in numbers, safety from our tribe. And so if we're in this tribe or in this system, and then there's this one person saying something different, just even how we feel in our body, like it just doesn't align with how we feel. Like maybe even logically, it might make sense to ask questions and lean into it and try and figure out. But what we feel is really what we believe as humans. And what we feel comes from our unconscious brain, which is not our rational thinking, logical brain. And so it's just so hard to get people to change logically. We really need to change how we feel, which again really aligns with the core of tenets of doing this work and getting better as well.
Hi, Becca. Thank you so much for coming on the podcast today. Really appreciate it. And I know that this conversation is going to be helpful.
Yeah, my pleasure. Great to be here with you.
Let's go ahead and jump right in. And why don't you share with us a little bit about who you are and how you got into this work professionally?
Yeah, so I'm a family medicine physician. I'm in Portland, Oregon. I've been a family medicine physician for over 20 years, 25 years. And I worked at large health systems. I was at Kaiser Permanente for 15 years, kind of a little bit into my career. And as a primary care physician, we see everybody that doesn't get better from everything else. So over the years, and especially working with such a huge volume of patients at Kaiser, as well as really seeing the whole full picture of everyone kind of in our integrated system there, just patterns emerged that were quite clear. I mean, to me, as well as most other doctors, I would say, but just so many symptoms that didn't really make sense physiologically. We couldn't help. We didn't really know what was going on. People had ongoing chronic symptoms. There was a lot of symptoms that would sort of move around in the same person, but the same kind of symptoms over and over. Also, the pattern that emerged that often people also had mental health diagnoses that sort of traveled together, but weren't exactly the cause nor the result. Sending someone to mental health often didn't help. And so it just became this big curiosity to me. It was like this, I couldn't scratch. And I just looked for years and years and years to search for better answers, not finding them for a very, very long time. And then I was very fortunate enough to come upon this mind body approach. My friend from medical school, who was a family medicine doctor, would send her patients to Howard Huebner. So I dove into it, and when I was at Kaiser, I had a little bit of time in the integrative clinic, so I started working with patients with this approach. And it was during the pandemic, and so I started seeing a lot of people with long COVID, and even right away, having thought about these connections for years, I mean, it already made sense to me that this is what was going on for long COVID. I was part of the long COVID clinic at Kaiser. I became the a clinician for the long COVID clinic, and so again, being in that huge health system, there's like 600,000 members in the Kaiser Permanente Northwest. All the people with any concern for long COVID funneled through our long COVID clinic, and there's only like four of us. So I had a huge volume of long COVID patients that I assessed, and the worst of the worst, I mean, like the most severe patients, I was the one of the long COVID clinic that they would send
Mm.
those patients to me. So I really saw the very, very, very severe patients, and I was able to help them with this approach. And then I tried really hard to communicate what this was to the
Mhm.
leaders, get this integrated even more. But it's just a hard ask. It's such a different way of thinking about things, and they're really hard to fit a square peg in a round hole in the medical system that's already really established. And so I decided to leave Kaiser a couple of years ago and just start my own practice. And so this is the work that I do completely. This is all I focus on now. And sort of with all that, the other part I think that's important to know also is that I came to this approach because of looking for answers for my patients. And then after I learned about the approach, I developed my own neuroplastic symptoms of quite severe pain and fatigue, which is, because our brain is really just so hilarious in that way. But because really it's about being trapped in our life. And I was trapped in that health system. There's a big stressor with a friend in my life and just a lot of those different things. And I have all the personality traits really that go along and with the neuroplastic symptoms in general. And so I went through my own experience as well.
Yeah. How was that going through your own experience already knowing this work?
It's so funny. I think there was so much about the experience of the symptoms that didn't scare me because I understood pretty much right out of the gates what they were. And I mean, they were severe. I had like burning pain throughout my body, especially at night that when I would like moan, I could barely even like sit up at night and really this, crushing fatigue. I could work still, but I really couldn't do much else. So on one hand, they didn't scare my conscious brain. Obviously, my unconscious brain had huge amounts of fear. And it's also interesting that I was helping people and people were getting better. But yet I was having these symptoms. But I think I mean, it certainly helped me to be a better clinician and better able to help people going forward. But there was part of me that both knew I could get better, so I had that belief and that confidence that I could get better, but by the same token, I also, like everyone else, I think that comes to this, also had my doubts that I could get better. That I mean, I think it's so common to see that other people have gotten better and think, "Yeah, yeah, yeah, well, this'll work for you, or you know how to do it, you can get better, but that probably won't work for me, or I can't get better." And I still had that part of it, part of that doubt in my brain as well.
As you say that, I'm also reflecting on so many people that come to this work. They've had so many experiences of something not working for them. So they've always felt like the outlier, right? And thinking, well, yeah, this isn't
Mm,
going to work because I've tried a million things and it hasn't worked.
yeah.
That can get ingrained in just our belief system and our perception of it, of this work too.
Mhm. Mhm. Yeah. And it's such an interesting statement to say that and really think about and reflect on that people feel like an outlier. And the reason I chuckle is because the reality is actually that outlier is actually in reality the norm. And I think really feeling like an outlier is probably because lots of different clinicians, things like I used to say to my patients before I knew about this, like, oh, well, let me give you X treatment and this should work. I've seen this work. So then it doesn't work, and then they feel like an outlier because their clinician just told them that it should work. But frankly, from my experience from the inside out, a lot of the things we do don't actually really work for a lot of people. And a lot of times that they end up working is really because of the placebo effect. And so then these messages that we're giving people as professionals that end up making them feel like the outlier is really more about an erroneous message from the clinician, I would say. I
That's
mean,
important. Yeah. Go
I
ahead.
mean, not that the clinician has any malintent,
Right.
right? If they want them to get better, they're doing their best. Is the best they know. So again, what I used to do, tried my best. And, would see some people getting better, but I think that, I think it's just so important for people to really recognize that having tried lots and lots of things, that often is because of, the situation of the clinician, having seen it work because of the placebo effect. Yeah.
Right. And so tying this a little bit back to what you said in the beginning of your experience with Kaiser and then leaving and going through your own personal experience with symptoms, because I'm just curious, what's the barrier do you think for maybe those other people in the clinic, those other clinicians to take on and understand this work? What was the
Mm.
difficulty there in you bringing it to them? What do you think that is?
It's funny. It's such an unbelievably different way to think about things,
Yeah.
on one hand. And so I think it's just such a big shift. It's just really hard for a human brain, frankly, to make that big of a shift in the first place. But the other part is that because it can feel like such a tiny little fine line between what lots of people say work that ends up to be alternative medicine, or what people are saying something works is really just working because of the placebo effect. And so then we've been told as clinicians so much over time, patients come in and they say, oh, well, I got better because of X, Y, and Z. But really, X, Y, and Z does not make sense
Uh,
physiologically, like, at all, and so they might come in and say, "Oh, well, I took this supplement and I did this whatever treatment and got red light therapy or this and that or manual manipulation of my," whatever it is. But from our scientific standpoint, it just doesn't really make sense, and they're getting better because of the placebo effect. And so then as clinicians, I think we just discount it because, well, number 1, we're like, "Oh, well, that's not scientific. It's woo-woo. It's, probably just the placebo effect,"
huh.
kinda stuff like that. Not to say that as clinicians, we shouldn't be more curious, right? I mean, I think that's the main thing is that however someone got better, what we should be doing is asking them, investigating it, going towards it, which unfortunately we don't do. But I think that there's been so much of that for clinicians that often we just sort of discount this and say, "Oh, well, this is woo-woo or this is the next thing or whatever." And I think then also there's just sort of the problem of, ego for people. I have my own ego, right? Did this, but so that gets in the way. And I think also even just when you think about this work, what we're working with is the survival brain. And the survival brain works by getting safety in numbers, safety from our tribe. And so if we're in this tribe or in this system,
Uh,
and then there's this one person saying something different, just even how we feel in our body, like it just doesn't align with how we feel. Like maybe even logically, it might make sense to ask questions and lean into it and try and figure out. But what we feel is really what we believe as humans. And what we feel comes from our unconscious brain, which is not our rational thinking, logical brain. And so it's just so hard to get people to change logically. We really need to change how we feel, which again really aligns with the core of tenets of doing this work and getting better as well.
yeah, of course. I mean, it makes sense. It is a very different way. When I first got into this work, I used to say that a lot, and I think I've kinda come away from it because it's my world. It's just normal to me now, and I forget that it
That is,
really is. Like, it's
I
a
know.
180 of you understanding
I
yourself
know,
as
right?
well.
Exactly. Yeah. And that's the thing. And when I first learned this, I used to walk to work at Kaiser and I would wake up in the morning and I would think, I mean, I would sort of have like this little panic where I would go, "Oh my gosh, am I really saying this to people?" And I would be, like, a little dissociated walking to work. I mean, it was, like, surreal. Just
Yeah.
spoke with this physician the other day who just recently learned about this, and she was describing sort of the same thing. But what kept me going is getting to work and enough patients, not all of them, but enough patients saying to me, "Oh my gosh, this is the first thing that actually makes sense to me." And it is true because really, as you put in the missing pieces, then all the information actually does make sense.
Yeah. I have clients often say that too. Not all, but some will say, "This just makes sense now.
Yeah,
This has to
right.
be the missing piece."
Yeah,
It does.
right, exactly. Yeah. And I think also what happens is that, again, as a human brain, if we have a model, like a very, very stuck in place model that we've experienced, the way that our brain works is it actually just discounts pieces of information. It's like Teflon, like the information comes in and it just bounces right off out of our awareness because it doesn't fit our model. And our brain then chooses the pieces of information that fit within our model. And so the information for saying to the doctors, trying to tell them about this new information or patients or whoever it is learning about it, is that our brain just sort of forgets about the information that doesn't make sense and takes the information where it does make sense. And we just put on the periphery of our awareness the pieces of information where there's actually absolutely no way in the world that it possibly could make sense, but we just have that outside of our awareness.
Exactly. And also, let's tie this into the placebo effect, or at least I want to talk about it. That even just that term can come with a dismissal, right? Oh, it's just the placebo effect. Oh, we learned about it in school when you learned about what research was and how, whatever grade that is, right? But we don't actually talk about what it really means and what it is. So, because, and you've mentioned it a few times. So, can you explain actually what it is and the power of it and why we, yeah.
Yeah, that's such a good point. And I think I did this as well, is that, we sort of, well, and actually this kind of brings a point that I think again, humans work on sort of two levels of thinking. And one is like level one thinking, which is just sort of the superficial thinking. And then level two is the deeper critical thinking. But that requires a lot of energy for our brain and attention, which is not easy to have. So most of us just exist in this plane up here of level one thinking. That's just, well, my mother had this, so that's why I have it. Okay, that makes sense, but we don't go to the deeper critical thinking. Well, why does that make sense? How does that make sense? So the level one thinking of placebo effect, which is kind of what I used to think about it, is, oh yeah, well, it's just that because of belief in our brain, we experience some symptoms in our body. Yeah, yeah, of course I know that. That's why we have randomized controlled trials. That's the scientific method. But really understanding in the deeper level to thinking about placebo effect is what the placebo effect is. Yeah, it's about just having the belief in our unconscious brain that creates the actual experience, like the same experience as the actual chemical effect, for instance, not a watered down experience, not a made up experience, but the actual same experience. And I think that that is the piece that we don't get. This isn't the placebo effect because my symptoms are so severe. So it couldn't be the placebo effect because we think about it that it's a watered down version often. Or, well, it's not the placebo effect because I didn't believe it was going to work. No, it's not about our conscious belief, actually. It's about the unconscious belief. Again, I came to this work for looking for my patients because I didn't, I mean, I did have neuroplastic symptoms in my life looking back. I mean, I think everybody does at some point. And when I was a primary care doctor at Kaiser and my two young kids were young and I had worked full time, my husband worked full time, I was having headaches every day that would start at like 3 p.m. on weekdays. They weren't super bad. I could still live my life, all this stuff. But my colleague prescribed me a medicine for it, amitriptyline, this little tiny, tiny dose. It's an old antidepressant that we use for chronic headaches to prevent them. And when she prescribed it to me, I mean, literally, my conscious brain was like, "Oh, well, that's ridiculous. That's not going to work," because I hadn't actually really seen it work in patients very well. It was such a tiny dose. So my conscious brain actually really didn't think it was going to work, but I was like, oh, I might as well, like, going to do something. And the first 3 nights, I was headache free. And I was like, oh, and it was like the first time I was headache free in months. And I was like, oh, well, this is great. This is awesome. Although I think I consciously was like, oh, well, that's a placebo effect. And then it's working.
Yeah. I mean, okay, so then after that, what did you just said, "Okay, yeah, I guess it was placebo, move on." Like, dismissing the placebo essentially, right?
Yeah. I mean, I still took
Go ahead.
it because I was hoping it would help. So I still took it, but I took it, I don't know, for like a couple months or so. And then it just didn't work after that, so I just eventually stopped it.
Yeah. Okay. So I wanna come back to long COVID and, get the understanding of how is long COVID the mind body placebo effect when a lot of people can be told that they have the spike proteins in their bodies or higher inflammation or extra things that are dysregulated in their body, their gut, whatever it is, like those physical explanations. So, how do you explain that
Yeah,
too?
I think in anything in life, and certainly in the science world, it's really important to ask, how do you know that? Why do you know that?
Mm. Mhm.
What's the evidence? Could there be another explanation? And it's key that we ask that about everything. And so, how do you know that? It's spike proteins, or it's a micro blood clot, or a cytokine, or mitochondria, or, all of these things. Well, frankly, we don't actually really know that. There has not been randomized controlled trials that have been reproduced that show that that is actually the answer. Those are all hypotheses. None of it has been scientifically proven. So if we look at, well, what are the studies that have been done? So for instance, with the persistent viral proteins, there's a couple of studies, but one of the studies, they're relatively small. There was, I don't know, maybe 120 patients or something like that. But in the control group, which means the group that did not have long COVID symptoms, Well, number one, in the first study, I really looked through it and I actually couldn't find any data to show how many spike proteins there were in the control group or, how much of the control group had persistent spike proteins. I couldn't actually find that data. It probably is out there someplace. But in the group with long COVID, I don't remember the exact numbers, but it was like 60% or something like that. Wasn't 100%. So
Uh,
there's a big chunk of people that have long COVID that don't have persistent spike proteins. Could people have long COVID for different reasons? Yeah, but generally speaking, in medicine, when we have to start explaining things in lots of different ways,
uh,
generally speaking, those explanations are not correct. Really, a unifying diagnosis is really what we find in science and in medicine is more likely to be the correct diagnosis. But then the second study, I think there was like 500 patients. And there was a little bit more in the long COVID group that had persistent spike protein. I think it wasn't even 50, half. So half of them didn't have persistent viral proteins. But then a good 20 or 30%, something like that, in the control group also have persistent viral proteins. So, well, then how do you explain that? And again, we can keep going with all of these things. Well, maybe the one set of people is responding differently to the spike proteins than others, or, we can like kind of spin this web to do these sort of mental gymnastics to make it make sense. But if we really look at the information, well, now are we just attributing the symptoms to this finding that's maybe just a normal finding in people after they've had COVID that isn't actually the reason? And again, it hasn't been found in studies to be the reason. And the same thing is true of like the micro blood clots. There was just a couple of small studies that were really assessed and not found not to be a very good study. And it was fibrinogen that was found, which is a precursor to a blood clot. It's not an actual blood clot. And actually, people that have diabetes or other chronic health conditions can also have increased levels of fibrinogen. So, and again, has not been scientifically sound. And then there's things like maybe cytokine changes or mitochondrial changes. And is that a downstream effect, meaning if our brain is constantly sending messages to our body that we're in danger, and so it's bathing our body in cortisol and stress hormones, there are changes that happen in our body because our brain and our body are connected and in constant communication. So maybe there's some cytokine changes or mitochondrial changes, but is that actually the downstream effect because we're chronically stuck in this stress state? Or is there something about the virus damaging those cells that then is the upstream effect? And again, really, that has not been
mhm,
found. So, there's all these pieces of information, but really, again, if you look at all of the information and you don't just allow inconvenient pieces to bounce off that doesn't fit your biomedical model, well, now let's look at lots and lots of times people's symptoms go away for a little while. They get better for a month or a week or a day or 6 months, and then they come back. And not everybody that has long COVID does this happen with, but a lot. Well, now how does that make sense? If there's persistent spike proteins or it's damaged cytokines, why does it make sense that it got better and then got worse? Doesn't really make sense. And then the other thing, if you look at the vast majority of people who have long COVID are middle-aged women, is the highest demographic of people that have long COVID, many of whom were previously actually fit and healthy. The demographic of people that get long COVID is not elderly sick people, like elderly people that have other medical problems. So if this is biomedical damage to your body, why would that happen more in healthy middle-aged women rather than elderly, frail people who had COVID? And also, why wouldn't it happen more with a really, really severe case of COVID, acute COVID? It can happen after a severe case of acute COVID, but oftentimes people had a very mild case. Sometimes so mild they didn't even know they had a COVID case. And in fact, some people have long COVID and did not even have the COVID infection at all, at all. And some people say, oh, well, it's just because I couldn't get tested or, you know,
Mhm.
the antibodies later found. But when I was at Kaiser in 2021, back then, patients said to me themselves, they said, oh, I never had the COVID infection. And this was actually back when people didn't actually have COVID. And they said, oh, I just had the vaccine. I didn't have the COVID. I didn't have the COVID infection. Okay, we'll talk about the vaccine in a moment. But
Mhm.
then other patients said to me, like, looked me in the white of my eyes, like, I didn't even ask them this. They said this to me and they said, well, I neither had COVID, acute COVID infection, nor the vaccine. And these are the same symptoms that I had prior to the pandemic even starting. And now they're worse, but they are the same symptoms of long COVID. So clinically, this is what patients were saying to me early on. And again, if we look through it through the lens, well, how does that make sense with a biomedical model that the COVID infection and virus is causing damage in the body? Well, it doesn't make sense. But if we look at it through the lens of how does our survival threat physiology brain work as a human being? It makes these danger signals. It makes headaches and fatigue and insomnia and anxiety and depression and dizziness and shuts down our GI system, right? That makes sense. The other thing that happens is that when we are stuck in fight or flight mode in our nervous system, again, there are downstream effects that happen. Like my body gets a lot of inflammation. Not
Mhm.
everybody's body does when they're stuck in fight or flight, but mine does. I can see swelling in my joints
Mhm.
when my nervous system is dysregulated and
Mhm.
stuck in the system. Rashes, like my body makes rashes. My eczema flares in my hands. It's sort of my personal beacon to know that I need to kind of take care of myself, put my tools back in place. And so these inflammatory things that happen in our body that we can see, or our muscles getting shut down, we can't move our body very well. That all happens with signaling from the brain to the body because our brain is perceiving threat.
I want to highlight what you just said about
Yeah.
the physiological changes that can happen, especially inflammation. I do work with a lot of people, and a lot of this audience have IC, and they're told that there's a lot of inflammation in their pelvic region, pelvic area, things like that, that's causing their pain. And I think the same thing. I've never said it or haven't said it out loud, but they don't ask the question, well, why is there inflammation in the first place? And you're
Yeah.
saying that exactly as well, the autonomic nervous system.
Yeah. I think there's a couple important points in there. Number one is, yeah, why is there inflammation in the first place? And so this is a question I get a lot. And I think that in this sort of neuroplastic mind body world, is that, often we can say, oh, this is 100% neuroplastic or 100% structural. And I think there's a lot of people that balk at that, which is understandable. And yes, things can be mixed. But what I would say is, number one, the vast majority of chronic symptoms are neuroplastic, are mind body as the generator. And that is after being a physician for 25 years, I've seen over 70,000 patients in my career. But the thing is, it's not to say that there's not then a downstream effect that then is coming back up and our brain is maybe now responding to that change in the body. Like my knee, for instance, is where my chronic pain started. I had my ACL replaced twice 20 years ago. I got a huge amount of swelling. I mean, swelling you could see across the room that like went down my calf. So the inflammation, that's those cells, the inflammatory cells that my brain told my body to make. Now those inflammatory cells, that message is going back up to my brain, and then my brain is now responding with warning signals to the inflammatory cells. So yes, it is responding to the structural change, but the generator of all of it is still my brain's threat response and my survival brain responding to danger in my life that
Mhm.
it doesn't need to be responding to through a threat response. So the root of me getting rid of all of it is still teaching my survival brain that it doesn't need to be sending these threat messages in the first place. So I would say two things back to the people who are told that they have inflammation. No, yeah, number one, well, why is your brain making the inflammation in the first place? And is it making it because some sort of structural damage? So if we tear a muscle or a ligament or a bone, the inflammatory response is generated because of the structural damage to your body. But if you just get inflammation out of the blue and there's no reason that your body was damaged otherwise, then that generally is happening because of a neuroplastic mind-body signal. So number one, why is your body getting the inflammation in the first place? But number two, I would also challenge people to ask, how does your clinician know that there's inflammation even in the first place? Right? Like a lot of times we're told, I've seen clinicians tell people, oh, well, the reason you're having that is because of inflammation, but they actually have no evidence to say that. Just saying that based on that you're describing a symptom. You as a patient are describing, oh, well, I have pain. And then the clinician says, oh, well, that's because of inflammation. But sometimes they don't actually have any objective evidence that there even is inflammation. I mean, there may be objective evidence. There's blood tests that show inflammation, or sometimes they can do a cystoscopy looking at the bladder and they can see evidence of inflammation. So sometimes there is objective evidence, but a lot of times I see patients being told that they have inflammation when it's just the clinician saying that. They're just kind of giving a reason for the symptoms.
I do have quite a few people that have had the scans and have blood tests that have that. So they have this test that says, my
Mhm.
body has inflammation. I have
Yeah.
marker. I have, right. And it's really stuck on that. And it's hard to understand the mind body work with that. So, how would you talk with someone about that?
Yeah. I mean, again, it's really understanding that when our brain is stuck in the threat response or threat physiology is that it can send messages for our body to make inflammation. Just like our brain gives, if we're embarrassed, our brain gives a message to our cheeks to change the capillaries so that they get red. I mean, we're doing this all day long. We smell a delicious cookie. There's nothing that changes structurally in our body. It is a message to our gut, and suddenly digestive juices change. We can hear it, we can feel it. Well, there was nothing actually structurally that changed. We didn't eat the cookie. It's just a signal that came into our brain. I mean, this is happening all day long. And what's interesting also, way before I learned about this whole mind body approach, the reason I came here is because of my clinical experience. Again, multiple patients came to me as I was their primary care doctor and told me that their experience of autoimmune conditions was that they had abnormal blood tests showing inflammation in their body, and that through their life, the blood tests would be positive when they were going through times of stress in their life and they'd have symptoms. And then when they were in times of, decreased stress in their life, their symptoms would go away and their blood tests would normalize. And the first time a patient told me this, I was like, what? Like, again, I sort of was like, what are you talking about? Like, what? I mean, like, I was on the other end of things saying, and this wasn't even someone that, like, knew about really the impact of the mind-body approach that we do here. They just were more a person noticing, "Oh, when I have stress, that affects me in this way." And it didn't like I mean, that was one of the things that I was like, "Well, that makes no sense," because I thought of an autoimmune disorder as, like, just this, illness in your body. We don't know why you have it, but it's this structural illness in your body that just some people have. We don't know why. And I never would have imagined that stress could be a very, very specific underlying generator of it. I want to say a couple of things about it. I do think, like with autoimmune disorders, I'm not necessarily saying like 100% mind body is going to, the direction that everyone should go, or it's going to cure everyone, anything like that. Needs tons of research. Lots of people who have gotten better. And in something like a severe autoimmune disorder in general, I do actually recommend taking the medicine from the rheumatologist kind of early on. I think that can be an important thing to do. you're also open to the mind body work, also implementing that and kind of seeing how it goes. But I do think it can be an important piece to just really think about and reflect and just notice kind of over time.
Yeah. That approach of both, right? Instead of this all or nothing camp. I think, especially for autoimmune, but in many different ways or conditions can be helpful. What about long COVID? How do you treat people these days that do come in?
Yeah.
Do you do any physical intervention?
No, no. I mean, that's the thing. I think again, it's both and again, the vast majority of chronic symptoms, I would say, are neuroplastic and really, really viewing it that the generator of the symptoms is these psychological stressors, how our unconscious brain, the survival brain is responding that it does not need to respond. And I think that it's very easy for people to go down the route of this helps structural and not structural, and I'm not going to, there's no reason to actually really hone it down so much. I disagree with that. I think that the more that like we really understand that the solution is in the brain and not in the body is the power in the tools. And if someone like 0.00001% thinks the problem is in the body, but 99.99999% it's the brain, that that amount can interfere with turning down the signal. And so with long COVID, again, from my perspective, there's just heaps and heaps and heaps of evidence that this is about threat physiology and that I think it's better termed a post-pandemic syndrome rather than long COVID even. And
Mm,
actually, even if you kind of coming back to the vaccines,
mhm.
again,
Yes.
loads of patients that have a long COVID syndrome after the vaccine. And sometimes the symptoms started within minutes of getting the vaccine. Well, there is nothing, again, so let's get to the level 2 critical thinking. There is nothing that a vaccine could do that's damaging our body that happens within minutes that then is going to last for years. It's just not how it works.
Mhm.
But I also have other patients that they had a vaccine and then they did fine and their long COVID symptoms started months afterwards. And now their clinician or themselves are attributing these symptoms that started months after getting the vaccine to the vaccine. Again, physiologically, if there's something that's damaging our body, that is just not how it physiologically works. The other thing is if you look actually at the vaccine trials, the group that got the placebo vaccine, so the group that got the saline injection did not get the COVID vaccine, 37% of them got side effects. This is what we call the nocebo effect, kind of the opposite of the placebo effect. It causes side effects. And they weren't lesser side effects. They weren't more mild. They weren't different ones than the people that got the actual COVID vaccine. Generally speaking, they were the same sort of side effects or as severe. Um, and again, the power of our brain that creates our experiences in our brain through unconscious expectation. So, and then if we look at huge studies of hundreds of thousands of patients, even one study out of University of Michigan by Daniel Claw, there was 3 million patients that he assessed, I mean, patient charts. But looking at the pattern and looking at the crossover of people that had a history of other neuroplastic symptoms or chronic overlapping pain conditions, they call them, things like fibromyalgia, chronic fatigue,
Mm.
back pain, headaches, things like that, is that that was a better indicator of whether someone would get long COVID than actually if they had actually had the COVID virus itself.
Wow.
So, anyway, lots of other huge studies that found that people that have a history of anxiety and depression or PTSD are more likely, like far more likely to get long COVID. So again, looking through the different lens of this new science, what makes more sense? So the work that I do with people with long COVID is really 100% about that the source is in the brain. I meet them where they are. I've had patients that were bedbound for a year, eyes covered, ears covered, not talking. Right. So I have to meet someone where they are and start with visualization and little by little, kind of moving into that their capability.
Yeah, definitely. When you mentioned the reaction in minutes, I actually had that same thing happen with food. Would have histamine reactions, and I could time myself within 10 to 12 minutes. I'd have
Mm,
a reaction, and I knew it was something I shouldn't have eaten. And even at that time, going back to the conscious and subconscious brain, even at that time, I kinda knew that didn't make sense, but I didn't know what
yeah,
else to do. Like, there was a part
right.
of me kinda like, "This is weird. This can't be," but also it's happening, I don't
Yeah,
know.
right. And if you don't have another better explanation, then you go with
Yeah. And then when
yes.
I learned, it clicked. I was like,
Yeah, right. Yeah, exactly. Right. And that's, an important point in all of this also is MCAS, the mast cell activation syndrome. I would say prior to it. So again, I've been a physician for 25 years, working full time in Kaiser in a big health system. We use evidence-based medicine. I learned from the specialists, all of these things. And I hadn't really heard of MCAS before the pandemic. And now everybody and their brother is diagnosed with MCAS,
mhm, mhm,
right? Often again, middle-aged, otherwise healthy people diagnosed with MCAS.
mhm,
And I've seen patients that have gone to, MCAS now specialists that have
mhm,
told them, oh, well, this is genetic. You've had this. Well, if it's genetic, you've had it for your life. But again, okay, level two thinking, how does that make sense? And they were told, well, this is genetic. You've had it for your life and you're going to have it for the rest of your life. Okay, well, why didn't they have any symptoms of it for the
mhm,
first 25 years of their life or 35 years or however many
mhm.
years? Why does that work? How does that work? And again, really what like true MCAS is really a huge gargantuan reaction that causes flushing and redness and swelling throughout the whole body. And a lot of people who are diagnosed with MCAS actually haven't had those symptoms. Some of them do have those symptoms, but again, that also can be the brain sending these warning signals as
Mhm.
well. And so many, 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 many patients of mine have been given the diagnosis of MCAS, but really their symptoms completely and wholly resolve when we teach the brain that the body doesn't need protecting and it dials down the signals.
Thank you. I had that on my list of something to bring up and talk about MCAS 'cause it's a big one.
Yeah.
And people are really scared of it. It becomes very intense.
Yeah, I mean, if you're told that you have I mean, any diagnosis, if you're told by a clinician, a specialist, and that you have something that we don't exactly know why you have it, or maybe it's genetic and you're going to have it for your rest of your life. I mean, how could that not possibly just instill the fear of God in you? I mean, oh my gosh, it's it's gargantuan. Yeah.
And then it gets worse because of that fear.
Hmm. Yeah. Right. Exactly.
Okay. With everything that we've talked about, is there anything else you feel like is important to note around this that people need to hear as we start to wrap up?
Well, I guess a couple things. One of the hardest, so for long COVID specifically, or other kind of adjacent sort of symptoms, is that one of the hardest parts that I find that gets in the way of people getting better is accepting the diagnosis for themselves that
Mm,
this is neuroplastic, it's mind body, and it isn't something structural in their body. And people have had so many tests that they can see in black and white are abnormal. And maybe they've had a cytokine abnormal test or a mitochondria test, and they're looking at that, or, you know, the blood clots, or other things, chronic Lyme or mold or heavy metals, or, there's a whole slew of tests. And again, it's really coming back to, well, why do you know that that's true and valid? What's the science that backs that up? And I ask people this a lot. I say, well, how do you know that that's true? And many times their answer is, well, because my naturopath or my functional medicine doctor or my, MD at the long COVID clinic doctor, they told me that. And, this is what they do. But that's not enough information. And really understanding that there is a huge amount out there, and I'm not pretending that I know everything either,
mhm.
for sure. But and I used to be this doctor too, that I would say these things because that's what I had been taught, and that's what I truly believed. But really, I think it's really, really important to understand that there are a lot of blood tests out there, other sort of tests that you can see in black and white it's abnormal, but it is not a scientifically sound test, meaning that it has not had rigorous scientific studies to show that it is accurate, meaning that whatever the abnormality is, number one, means that that's what's actually going on in your body. And number two, that that is the specific reason for any particular symptom. And it can be really hard to let go of that information once you see it and you've been told the information by a trusted person. And again, it's not that anyone is malintent. And
Mhm.
people probably their lived experience as a clinician is that they've seen people get better when they've given them the supplements or treatment or whatever they do. And so it's not that they're making it up and it's not that they're not authentic. It's just that because of the placebo and nocebo response and that there isn't, this rigorous scientific studies in all of these different areas to know, that that's the reason why the information is given to someone.
Mm, okay. Thank you for saying that.
I guess the other piece, if I can just also put in, is that what I've seen a lot too is that sometimes people do some mind body techniques and they don't get better. And so then they go back to, well, this must not be neuroplastic or mind body because I've tried the mind body approach and it didn't work. But that's really diagnosing in the opposite direction. We diagnose first by what makes sense, looking at the evidence, going through the fit criteria,
Mhm.
do your symptoms come and go? What testing have you, all of that.
Mhm.
But then it's okay, well, now I know the diagnosis, and it can be a journey of figuring out for you. Like for me, I actually had symptoms for a couple of years, and I knew that this was mind body the whole time, but I didn't, I was whatever, I'm a human and
Mhm.
just willing to sort of put up with it and not actually face the deeper emotional challenges. And I
Mm,
think that there are things that can help calm down the symptoms a little bit. Nervous system regulation tools can, help a little bit, or,
mhm.
PRT, somatic tracking can kind of turn off a symptom. But if we don't really walk towards that closet door and open it up and show our unconscious brain that the monsters it thinks is real aren't really real, then our brain will keep dysregulating our nervous system and really doing the deeper emotional work of getting out your repressed emotions, really facing the fears that your brain has deeply rooted about who you are as a person, or facing difficult boundary setting or conversations. And that's not easy, for
Mhm.
sure. Absolutely. But what I would say is I think that it's often easier than we think it is. And on the other side of it is just a whole beautiful world and life that people who get there never imagined that they would be able to get there.
Yes. Yes, 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 yes. That is what I talk about a lot in terms of when are they stuck? Why am I stuck, right?
Yeah.
I think being a therapist, I end up getting people who've tried some things, and then they're
Mhm.
like, "Well, nothing's really worked. I've tried it on my own," or maybe a little bit, right? I mean, a little
Yeah.
relief, but I don't understand what I'm missing, or maybe this
Yeah.
isn't my body, right? And they then think about trauma, and they're like, "Well, what do I do with that?"
Mhm.
Anyway, so yes, there that
Mhm.
second piece is really important. Really,
Yeah.
really
Mhm.
a
Yeah.
deeper layer. Yeah.
Exactly. Yeah. And I think also the other piece is really often actually completely stopping anything body based can be really helpful actually, and it can feel kind of scary to do, but it can be the sort of last bit of cutting the cord where it's really stepping into that kind of scary space. Like, look, your body is not damaged. And I didn't do many body based things,
Mm,
but, like, the few things I did, like, every now and then I would take an ibuprofen, like, literally I took, I don't know, half a dozen in the 2 years. But when I took it, my symptoms would go away completely. Was it because it's an anti-inflammatory? Was it because of the placebo effect? I have no idea. But the thing is I actually had to stop taking it completely, even though I was, like, barely ever taking it, because when I took it and my symptoms went away, when I woke up the next day and my symptoms were gone, then what it did is it actually scared me that I wouldn't be able to get rid of them without having something external. And the same thing happened with massage. I love getting a massage. So and I had all this pain in my neck, my back and stuff. And I would go to a massage therapist and I would say, please do not tell me anything about my body. Like, I don't want you to say, oh, this is really tight. Oh, this is this. Just give me a massage. I just, because I wanted to just go get it and relax and enjoy it. But it only helped such a small amount of time, and again, I just sort of felt like, well, now I'm just focusing on getting rid of this trying to get rid of this muscle tension from my body, and so really what I had to do is stop doing that, and really, when I would feel this sort of tension come into my brain and think from my brain to send down a message from my brain to my body, breathe into my body, and just kind of send messages for it to relax instead.
I've done the exact same thing with massage.
Yeah.
And to this day, I will not if I do get one, they'll ask, what's going on. I'll never say anything.
Yeah.
I'm just here to enjoy,
Yeah,
Yeah.
yeah, exactly.
Okay. Thank you so much again for coming on. This is a wonderful conversation, and puts
Yeah, my pleasure.
a lot of validity to what we talk about on here. And
Yeah.
I do appreciate the approach of really solidifying, "This is my body, let's work with this."
Mhm.
And the questioning is normal, totally, because this is a whole other way of thinking of it, right? But we can really solidify in this and work in this space. There is a whole other world on the other side that's beautiful.
Yeah, right, exactly. Awesome. Well, thanks so much for having me on and for the great work that you do. I appreciate it.
Yeah, for sure. Okay, and I will talk to y'all next time.